Good day, I am Miss Mia Isabel Albatario from 1BSNB, and for today I will be performing our turn demonstration for bathing an adult client. So for today I will be placing my device into a position where you can clearly see the client and the procedures that I will be doing for today. So let me just ensure the camera. So now, to proceed and conduct the physical assessment and the return demonstration, firstly, for the preparation, we need to determine the purpose and type of bath that the client needs. So, this is to provide the appropriate hygiene care appropriate to the current needs of our patient. And the type of bath that we will be doing is a full body bed bath. So now is to determine the self-care ability of the client. So ma'am, may I know, can you still give yourself a bath, or can you still move by yourself, or do you need my assistance?
I need your assistance.
Okay, so the client has said that she needs my assistance. So this is important to encourage independence and assess the level of assistance that the client requires. And lastly, we need to determine any movement or positioning precautions specific to the client. This is for us to prevent any injury during the bath, especially if there are any physical restrictions. So now that we are clear with those things that needs to be determined, now we can proceed with the assessment. So for the assessment, we need to assess other care the client may be receiving, such as physical therapy or x rays, and in order to coordinate all aspects of healthcare and prevent unnecessary fatigue. So, ma'am, may I know, are you receiving any other care, such as physical therapy? No, okay, so that is noted, ma'am. How about any x rays?
No.
No, okay. So this is important for us to assess. Okay, let me just move this over here. Okay. This is important for us to assess, as this is to avoid any conflicting with the treatments that the client may be receiving currently. For example, we have to avoid bathing a client immediately after therapy. So now we can proceed with the next thing that we need to assess, which is the client's comfort level with being bathed by someone else. So, ma'am, would you be comfortable with me bathing you? Okay, so again, this is important for us to assess and ensure that ensure that the client is comfortable with us. This is to promote the client's security and dignity. So now lastly is to assess the necessary bath equipment and linens. This is to ensure the efficiency and minimize client exposure and discomfort. So for that, what we have here are some linens, a top sheet, and a blanket for the client's dignity and modesty. So now, after clearing all that, now we can proceed with assembling the equipments and supplies, which we will need a basin or sink with warm water, which we have over here where it is safe and will not spill. And next is we need a soap and soap dish. And next is the linens, as I have said, the bath blanket, two bath towels, which is right over here, and washcloth, a clean gown or pajamas or clothes as needed, and additional bed linen and towels if required. And then also we will need clean gloves, if appropriate. For example, if the client has any skin conditions, which and we will need some clean gloves, which is what I am wearing over here. This is also important for us to prevent infection transmission. And then we need also to have personal hygiene articles, shaving equipment, which is usually needed for most of the male clients, and then table for bathing equipment, and then laundry bag. These supplies and equipments are important to individualize care and ensure proper disposal of soiled linens. So now that we are done with assembling the equipments that we can now proceed with the procedure. So firstly, we have to um, explain to the client what we are going to do and why this is necessary, and also how they can cooperate. So ma'am, what we will be going to do today is to bathe you, okay ma'am? So this is important for us to conduct for for you to be more comfortable in your bed and in here with us in the hospital, and this will ensure your body's cleanliness. And how you can cooperate with me is just to lie down there comfortably and just do the things that I will be needing you to do, such as going over to your sides or any more several positions. So, is that clear, ma'am, with you? Okay, thank you so much for your cooperation, ma'am. Now, that is important to reduce the client's anxiety and gain cooperation and promote the trust, and we have built our rapport. So now we can proceed with washing our hands and observe other appropriate infection control procedures. Assuming that I have washed my hands already, and for the other appropriate infection control procedures I have here is my gloves to avoid any more transmissions of any microorganisms or infections that can possibly harm the client or could harm me from getting that from our client. And also, what we can do is apply alcohol and wear face masks, PPE, hair caps if needed. So now we can proceed with providing our client privacy. In providing the client privacy, what we can do is closing the curtains and then closing the doors to ensure that the client has her own personal and private room. And then what we can also do is, in providing client privacy, is to cover the several or the body of the client. This is for us to promote the client's dignity and modesty. So, also comfort. So now we can proceed with preparing the client and the environment. For that, we need to close the windows, as I have said earlier, and the doors, and to ensure the room is a comfortable temperature. And this ensures a warm and dust-free environment to prevent chills to the client. So now we can offer the client a bedpan or urinal, or ask whether the client wishes to use the toilet or commode. So, ma'am, may I ask, do you want to use the toilet before we proceed or commode? No. Okay, so that is noted, ma'am. But if ever that you may wish to go to the toilet, just inform me, ma'am, okay? And then I will assist you, okay? So, since the client does not need to go to the toilet, we can now proceed with the procedure. So, that is important to ask, for that promotes the client's comfort during the procedure and avoid any interruptions. So now we can encourage the client to perform as much personal self-care as possible, as this promote independence and preserves the client's self-esteem. So, ma'am, if you can just move your body and help me, then you can do as much as you can. Okay, ma'am? Okay, so now we can proceed with the next procedure, which is during the bath, we have to assess each and area of the skin carefully. And this is important for us to have an early identification of skin issues like redness, pressure injuries, or breakdown. And assuming that I have given our client a bath earlier, I have not seen um, any dis- deformities or any abnormalities, any redness or breakdowns of the skin or pressure injuries. And also, now we can proceed with the next step, which is to prepare the bed and position the client comfortably. This is um, this is where we will be positioning the bed at a comfortable working height and lower the side rail on the bed on the side that is close to me, and keep the other side of the rail up and assist the client to move near me. So, assuming that this is a hospital bed with side rails, then if I am here, then I will need to raise the levels up and over there, which is the opposite side of me, the rails up there, and lowering the rails over here on the right side of the patient as I am here, and which where I will be working on. So um, now we can proceed with um, removing the client's gown while keeping the client covered with the bath blanket and place gown in a linen hamper. So earlier what we did, that is important for us to promote the nurse ergonomics and ensure the client's safety. That is for us to ensure that the client won't roll over to the other side, opposite side of me, and promote or give further pain and harm to the client. So it is also important to assist the client to move near me to minimize the strain for both the client and for me. So now, in removing the client's gown, we have to preserve the warmth and client's modesty. So I will be removing the client's gown while keeping the client covered with the bath blanket. So in getting the client's gown, ma'am, let me just um, have your arms over here and get get the robe or the client's gown out. Okay, so okay, thank you so much, ma'am. Then the other side, you can just get again your arm. Okay. So ensuring the privacy of the client, I will be getting the gown down over here. So now that I have gotten her gown, I will be now placing this in a linen hamper. Okay. So now that we are done with getting the gown of the client, now we can proceed with making a bath mitt with the washcloth. Okay. So What I have here is the washcloth, and I will be making a mitt, like um, here. Okay, just excuse me for a moment while I'm still making the mitt. Okay. Okay, so here. So, ma'am, how are you feeling over there? Are you still good?
Yes, I'm
Okay.
good.
That's good to know, ma'am. So, if any discomfort persists, just tell me, okay? Okay, so now that I am done with making a bath mat with the washcloth, this will be controlling the washcloth better, and this will be improving our cleansing and avoid dripping of the water that we will be getting from the basin or sink. So now we can now proceed with washing the face of the client. So I'll be dumping the washcloth now to the basin and getting the water. So, but before that, we need to also place a towel under the client's head. So, this is for us to avoid any dripping or soaking of the client's pillows. So, ma'am, let me just assist your head over here. Okay, so now that we are done with placing that towel on under the client's head, now we can proceed with washing the client's eyes with water only and dry them well. We will be using a separate corner of the washcloth for each eye. So I will be starting to the other side or the opposite side of me, and starting from the inner surface of the client's eyes to the outer, and then to the one near me, then other side. Okay, so now that we are done with the eyes, now we can proceed with drying the part that we have um, we have washed using a separate dry mitten. So just close your eyes. Okay, on the opposite side. Okay, so now that we are done with that, we can now proceed with asking the client whether if she wants soap used on her face. And then this is important for us to conduct and ask, as this respects the client's preferences and prevents dryness for the client's skin. Earlier, what we did with just water only and the surfaces of her eyes, this prevents irritation from soap and prevent cross contamination, which in where we used separate or opposite corners of the mitten. So, ma'am, may I ask, would you like me to use soap in washing your face?
No,
No.
just water.
Okay, so the client just wants us to use water again, so we will be respecting her decision and just use water and washing her face. So now I'm just still doing my mittens. So now we can proceed with washing the client's face along with the client's ears and her neck. So I'll be starting again to the opposite side of me. So I'll be using this side. So starting from the forehead to the ear, to the cheeks, and the chin, and to the neck. Can you raise your chin, please, ma'am? Okay, thank you so much for your cooperation. So now we can proceed with the opposite side of the mitten. So here. Okay, so here on the forehead, can you turn your face your right? Thank you. Ear, cheeks, and to the neck. Okay, so thank you so much for your cooperation, ma'am. So we will just be including again her neck. Can you raise your chin, ma'am? Okay. Other side. Okay. So thank you so much for your cooperation, ma'am. Now we can proceed with washing the arms and the hands. So what we will be needing to do there is to place a towel lengthwise under the arm of the client away from me, and then wash and rinse and dry the arm by elevating the client's arm and supporting the client's wrist and elbow. We also need to use long, firm strokes from wrists to shoulder, and we have to also include the axillary area of the client. So here I am just doing this mitten again. So I will be needing another another towel. So let me just turn this into a lengthwise size. Okay, so now let me just turn this blankets to expose the part that we need to wash. So I'll be placing this towel lengthwise over here to the opposite side of me. So, okay, thank you so much for your cooperation, ma'am. Okay, can you raise your arms up? Okay, thank you. So now we can proceed with washing the client's arms from her wrists to the shoulders, making sure that we use opposite sides for each. Okay, wrist, shoulders, opposite side. Okay, so that is done. Now we can proceed with washing the hands of the client. I'll be placing this over here, and then making sure to also to include the spaces in between the fingertips of the client. Okay, so thank you so much, ma'am. Now we will be proceeding with um, if ever we have to ask the client, we have to apply deodorant or powder if desired, and we have also to take special precaution if needed. Special precaution is needed for clients with respiratory alterations. This enhances the comfort and prevents skin irritation for the client. We have to earlier what we did there is to place a towel on the bed and put a wash basin on it, and we have placed the client's hands in the basin, and then um let me then we have also and then also I have assisted the client as needed to wash, rinse, and um we will be proceeding with drying the hands and paying particular attention into the spaces in between the fingertips. Here we will be patting dry the parts that we washed. So including the axillary area and the hands. So now we have to ask the client whether she prefers to apply deodorant. So, ma'am, would you like me to give you or apply deodorant later on? Okay, so I will just be covering this side of the client and getting the towel under her arms and proceeding with the other arm. So now let me just assist you. Trace your arm. Okay, thank you so much for your cooperation, ma'am. Providing the client her privacy. So again, we need to wash the opposite side of her arm. Just rinsing the mitten. Starting again from the wrist to the shoulder. Assuming that the client has no clothes on and I am reaching over her shoulders. And ensuring that it gets over to the axillary area of the client. So then her hands, and the spaces in between her fingertips. And then after this is to dry her hands clean. Okay. So now that we are done with that, we just place the basin over in here and dry again. Just letting them dry. Okay, so now that we are done with that, I'll be getting this towel mat. So thank you so much, and then placing this one again to provide the client privacy and warmth. So now we can proceed. We can proceed with applying the deodorant for the client. So, ma'am, would you like me to help you give you deodorant? Okay, so starting again from the opposite side. Like this. Okay, thank you. Other side. Okay, thank you so much, ma'am. Okay, so now after um giving the client the deodorant, now we can, and also we have repeated for the hand and arm that is near to me, we have to also exercise and caution if an IV infusion is present and check its flow after moving the arm, and we have to also avoid submersing the IV site if the dressing site is not clear, transparent dressing. So this avoids dislodging IVs or interfering with dressings. So now we can proceed with washing the chest and abdomen of the client. Then we also have to omit the chest and abdomen for a partial bath. However, the areas under a woman's breasts, um, we have to place the bath towel lengthwise over the chest and fold the bath blanket down to the client's pubic area. This will be preserving the modesty and warmth of the client. So we have to also lift the bath towel off the chest and bathe the chest and abdomen with our mitted hand using long, firm strokes. So I will be placing this bath towel over the client's chest. Can I use this one? Okay, and then getting the bath blanket down to her pubic area. Okay. So, ma'am, I will be exposing your abdomen. Would you be comfortable with that? I will be bathing your abdomen in a minute. So we will be using long firm strokes. And then let this back in here. We also have to ensure that we get the sides of the client's sides of the abdomen. So after that, we can now proceed with drying the abdomen. Letting them dry. Okay. Thank you so much for your cooperation, ma'am. I'll now lower down the clothing of the client and then proceeding with getting the blanket on the top and put it on her top. And then proceed with getting the bath blanket. So that we can ensure the client's privacy. So now that we are done with doing the washing the chest and abdomen of the client, we also have to give special attention to the skin under the breasts and on any other skin folds, particularly if the client is overweight. And we also have to rinse and dry them well, as that would prevent the moisture accumulation and fungal infections for the client. We have to replace the bath blanket when the areas have been dried. So now we can proceed with washing the legs and the feet. In washing the legs and feet, we have to expose the leg again farthest from me and folding the bath blanket toward the other leg, and being careful to keep the perineum covered. We have to lift the leg and place the bath towel lengthwise under the leg and wash and rinse and dry the leg using long, smooth, firm strokes from starting from the ankle to the knee high to the thigh. And that will improve the blood circulation of the client's leg. Then, after that, we'll just be reversing the coverings and repeat to the other leg. And then we can now proceed with washing the feet by placing them in the basin of the water after doing all that. So now I'll be proceeding for the first leg, which is the one farthest or on the opposite side of me. So just doing this mitten. Excuse me for a bit. So I will be folding. Can you please turn to supine position? I'll be folding this opposite side of me, ensuring that the perineum is covered. Okay, so starting from the ankles to the thigh using long, firm strokes. Okay, so other side. Side. This is okay. So now that we are done with that, we can now proceed with the doing the foot of the client. So, ma'am, may I ask first, would you like me to do this foot first or just proceed with the other leg and then foot after? No, this one. Okay. So that ensures that we have informed consent and agreement. So now I'll be starting from the lower part. Okay. So other side. And then ensuring that we get to the spaces of the client's um, toes. Okay, so thank you so much for your cooperation, ma'am. I'll now be drying them with the dry towel.
Asan na yung ano nila? Tawag.
So now we can proceed with for the other feet or leg. Let me just get this towel and then place it on the other side. So now we can proceed with the other side or other foot leg that is near me. So I'll be placing again the towel. So we're just making mitten again. So starting from the ankles to the thigh, side, ankles. Okay, thank you so much, ma'am. So then proceeding with the foot, wherein we will be getting the base. Just make this mitten again. Just raise your feet now. Okay, so starting here, other side, and to the spaces of the toes. Thank you so much. So now that we are done with that, we can now proceed with drying them. Letting them dry. So now that we are done with that, now we can proceed with um, once that we are done with drying each foot of the client. Let me just get this towel now and give you your privacy and warmth and comfort. Now we can proceed with obtaining the fresh and warm bath water. And since we um, have what we have done is just wash the foot of the client, which is known to be the most dirtiest part, or can be considered as the dirtiest part, as that touches the floor. Now that I have my other fresh and warm bath water, we can now wash the back of the client and then the perineum. So, and for that procedure, we have to assist the client into a prone or side lying position facing away from me, and place the bath blanket, or I mean the bath towel, lengthwise alongside the back and buttocks, while keeping the client covered with the bath blanket as much as possible. We also have to wash and dry the client's back, moving from the shoulders to the buttocks and the upper thighs, paying attention to the gluteal folds. This allows us to have better access to the back, and we have and that also would stimulate the circulation. So we have to assist the client to a prone or side lying position away from me. So ma'am, would you be comfortable with lying on your abdomen or your stomach or your tummy, or would you like to be lying on a side lying position?
Side lying.
Okay, side lying position as the client is requested. So since the client is mobile, um, the client has turned into a side lying position, and we can now just expose the part that we will be needing to wash. So assuming that the client is in a naked state or without clothes, then we can now just wash and dry the client's back, moving from the shoulders. Wait, let me just finish making a mitten. We can now proceed with washing from moving from the shoulders to the buttocks and the upper thighs, and then we have to pay attention to the gluteal folds of the client for us to observe cleanliness and to prevent any more infections to the client. And then what we will be doing is to give strokes in there, that, and then side, and then assuming that we have already done that and we have performed it, now we can proceed with asking the client if they would like for us to perform a back massage now or after the completion of bath. So, ma'am, may I ask, would you like me to give you a back massage?
No, it's okay.
Okay, so the client says it's okay. So now we can proceed with assisting the client to the supine position and determine whether the client can wash the perineal area independently. So, ma'am, I will be assisting you to turn back into your supine position right here. Okay. Okay, so let me just give you a blanket again. And ma'am, um would you like my assistance to give you a perineal bath, or you can do it yourself?
I can do it myself.
Okay. So you can do it yourself. So since the client has said that she can do it herself, now we can proceed with assisting the client with grooming aids such as powder, lotion, or deodorant. So, ma'am, um, what would you prefer, a lotion or powder or deodorant? Powder. Okay, so in using a powder, we have to use powder sparingly, wherein we have to release as little as possible into the atmosphere. This is for us to ensure that the client won't get suffocated with the dust or the particles of the powder that could um, give the client any more discomfort. And then, assuming that I have my powder in here, so I'll be starting to her face and to the other parts of her body that needs to or the client prefers to put powder on. So now we can proceed with helping the client to put on her clean gown or pajamas. So this part will promote the client's dignity and also independence. So let me just turn this to the side. So, ma'am, what I have here is your clean gown so that you can get your clothes back. So I'll start over here. So ma'am, just you can hold your blankets like this. Another side. This is for us to ensure that that your blanket won't get removed. So here, just turn your hair. Okay. Okay, thank you so much, ma'am. So now that we have assisted the client in wearing her gown, now we can assist the client to care for the hair, mouth, and nails. Some people prefer or need mouth care prior to their bath, but for that, that promotes her dignity and independence again. So, and helping the client to put on clean gown and pajamas that will restore the client's comfort and prepare them for activity. So now that we are done with all of that, we can now document the following that we have did earlier, which in the type of bath that we have given to the client. This is usually recorded on a flow sheet, and then also document the skin assessments such as excoriation and erythema, exudates, drainage, rashes, or skin breakdown. This ensures legal accountability and continuity of care. And earlier, when I was giving the client a bath, I have not seen um, any skin abnormalities or deformities. So we can proceed with documenting the nursing interventions related to the skin integrity of the client and the ability of the client to assist or participate with bathing. Like earlier, the client can raise her hands and help me, and then we have to also document the client response to bathing. Also, we have to document the need for reassessment of vital signs if appropriate, and educational needs regarding the hygiene, and information or teaching shared with the client or their family. So now that we are done with all of that, we can now proceed with ending the video as we are done with the return demonstration. Thank you so much for watching.